From the family's perspective, the Chinese culture's principle of not telling her is that they are arguing not to harm Nainai's general or emotional well-being versus a more Western perspective that doing no harm actually means not to harm Nainai's quality of life, physical, clinical conditions, right, according to Beecham and Chodris. So both of them are talking about doing no harm to Nainai, non-maleficence, but they mean different things because of different specifications, right? Same principle, different specifications from different perspectives. So shifting away from treating theories as foundations, what I'm trying to say is we should treat them as perspectives, as lenses, okay? So pick one up, pick a pair up, look at the problem. Each perspective brings something unique and true to the picture, right? So bioethics is not about training ourselves to be the defender of a particular selected theory or school of thought, but training ourselves to be able to use these different perspectives as our tools that help us to see the picture from different angles. And that contributes to the robustness of the whole idea of pluralism. So robust pluralism in bioethics acknowledges the importance, contribution, and strengths of each of the moral accounts, but also critical of the limitations of each of them. But it calls for acknowledgement and balancing, weighing of the different perspectives to make a considered judgment. So moral residues, moral tensions still exist, whichever moral judgment we've made in these kind of situations. The focus should not be on coming up with or defending the best theory, but on making meaning out of our human experience.
The Shinmi is often described as treating the patient as if they were one's own family with emotional warmth and personal commitment. So I began to see Shinmi as a kind of virtue. But like any virtue, it can become problematic if taken too far. So too much emotional involvement may lead to burnout or loss of objectivity. Too little may come across as cold or uncaring. So from a virtue ethics perspective, I suggest that the ideal form of Shinmi lies in a balance between the extremes, not too distant, not too enmeshed. I will show you some comments, very interesting comments from 3 countries. So for British participants said, TIV is a highly burdensome, costly, and limited medical resource. Even if a patient wishes to receive it, it may not be realistically feasible, and it may not necessarily provide the benefits the patient expects. For this reason, we do not bring it up unless the patient asks about it. So American participants said, in the US, patient autonomy is considered the most important. So although TIV is a burdensome and costly treatment, it is ultimately up to the patient to decide. So in Japan, it's totally different. We try to talk about TIV as value neutrally as possible. If we say anything negative, people might accuse us of denying the value of the lives of those who are living with TIV. I asked them when the patient wished to stop TIV. So in the US and UK, the participants say the same thing. So under UK law, continuing treatment against the will of the patient who does not want it is illegal. And American doctor says he does not need his parents' permission. On the other hand, in Japan, respecting his wish to withdraw TIV could cause a social scandal. Legally, it might be seen as a murder or assisted suicide. Since TIV can sustain life for years,
the historian Ronald Wright has done work on this, as have others, is that when we come up with new technological advances, the natural history of this is that it increases disparities rather than reduces them. And he calls this notion the progress trap, right? We oftentimes look at progress as good in and of itself without asking the questions about where it will lead us. And so the question we really want to ask with you today is, if we do it differently, how could we avoid this progress trap, and what could global bioethics contribute to that? There are both risks of haste in bringing up models of big data, right? Bringing computers, bringing augmented intelligence into the mix. We do need, in many ways, to be scanning the horizon with the clarity both about the aims of what it is that we want to do and the possibilities of what we can do. What we will do with the capacity to harness data at orders of magnitude, incomprehensible orders of magnitude greater than what the human brain can do itself, right? We can do that, and we can do that and bend the arc towards our shared humanity and our common good and flourishing. Thank you so much.